Welcome, everyone, to this edition of the Healthcare Labyrinth Podcast. My name is Marc Ryan, and it's a pleasure to be hosting this podcast, and thanks to everyone for listening in. As I always do, I will give you a brief overview of the Healthcare Labyrinth website, which is at healthcarelabyrinth.com. We have three sort of offerings there. The first is a daily weekday news feed where I summarize and editorialize on some of the news of the day. That's at the newsfeed tab. I do 2 blogs a week at the blog tab, and those are on major topics of healthcare. And then third, once a week, we do a podcast, and the podcast is available on the website, but it's also available through leading podcast websites and applications out there. My book, The Healthcare Labyrinth, is also available at healthcarelabyrinth.com or through leading booksellers. There's a print version, an ebook version, and an audiobook version. So you can get all your latest news at healthcarelabyrinth.com and also order my book there. So let's get right to the topic of this podcast. And it's really examining the difference between President Biden's and former President Trump's views on healthcare. Why are we doing this? Well, so far we've had the big Iowa caucuses that were dominated by Donald Trump, as well as the New Hampshire primary, which was a little bit closer, but still Donald Trump won handily. So it looks more and more as if Donald Trump will be the Republican nominee for president for 2024. Nikki Haley, who is the former South Carolina governor, looks badly behind right now in South Carolina, which is sort of the next major primary out there. Again, Trump appears to be marching very quickly toward wrapping up the nomination. President Biden has a couple of contenders he has to go up against. But again, it's pretty much a well-known fact that Biden will win the Democratic primaries. So we already pretty much know what our November 2024 election ticket looks like. So what I would like to do here is really just sort of compare and contrast the healthcare agendas of both President Biden and former President Trump. Just at the outset, I wanted to say that, number one, in many areas, President Biden's policies on healthcare look extremely different than President Trump's. In general, Biden is sort of a big, expansive coverage type of president, and that can be seen in his Affordable Care Act and Medicaid policies, whereas Donald Trump is really less coverage oriented, and that can again be seen with his proposals to repeal the exchange and his feelings about Medicaid expansion along the way as well. And so there are some other topics out there where they look a little more alike, and we'll be talking about them. And one of them is clearly drug pricing, which is a little bit interesting and a little bit unique for the Democratic and Republican nominees to have similar histories and similar views on given issues. So we'll basically go in order here. I wanted to start off and say one thing. So as many of you know, I am a Republican, but I am a fairly moderate Republican on healthcare issues. I believe in coverage. I believe it's a great thing for people to be covered. But number two, I also think economically we can save a great deal if we had affordable universal access within a private model, I believe. So I just wanted to say that right from the start, because clearly that colors some of my opinions out there with regard to, politicians' views on coverage and things like that. And I happen to believe that, generally speaking, the American public supports coverage. And that may or may not be the case with some Republican politicians, however. So let's get right to it. We have I'm going to try and keep this relatively quick here. I've sort of laid out about 8 issues that I wanted to cover to show where perhaps President Biden and Donald Trump have things in common and where they do not. So the first area that I want to open up with is Medicare Advantage. This is the private alternative to the fee-for-service system, which is known as Medicare, traditional Medicare. So Medicare Advantage is the private product that is offered by private plans on behalf of the federal government, and the fee-for-service program is where the Centers for Medicare and Medicaid Services contract directly with providers to furnish care within that traditional fee-for-service program. So in a general sense, both President Biden and former President Trump support Medicare Advantage by and large. I think, as most Democratic and Republican politicians do, they see how Medicare Advantage is growing in each and every year, and it's hard to oppose Medicare Advantage per se. There are some Democrats out there that are fairly militant on this issue and would like to see Medicare Advantage fail in favor of, say, a Medicare for all type of single payer system in the country. And they see Medicare Advantage as stopping something like that, given its success. But most Democrats and Republicans, again, have a hard time opposing the success and the value and how voters really rely on Medicare Advantage out there. Now, in a general sense, Trump was very in favor of expansion during his 4-year earlier term. His CMS administrator was very, very friendly toward the program as well. And there were a number of areas that were undertaken that largely favored the broader expansion of Medicare Advantage. When it comes to Biden, again, there's general support out there. But most recently, the Biden administration, through HHS and CMS, has sponsored some rules, as an example, that very much could undermine or create a situation where it is much harder to grow Medicare Advantage, and the benefit structure in Medicare Advantage that has grown over time could very much be in jeopardy. So the Biden administration finalized what's known as the risk adjustment data validation rule. It's being challenged by Humana as one plan, who believes that there are a number of due process and other issues with the rule. But in general, these data validation audits could mean the major recoupment of funds from MA plans through an extrapolation methodology that is very, very controversial, and yet the Biden administration moved forward with it. In the last couple of years, perhaps less driven by politics and a little more by the economy and policy, the rate structure in 23 and 24 and what rate increases will be has come down dramatically. And so that's another example of Biden's administration sort of tightening the screws on Medicare Advantage. And last, I talk about the prior authorization rule change that went into effect on 1/1/24, which will probably lead to huge medical expense increases because it severely limits the ability to perform prior authorizations in Medicare Advantage. So again, general support from Biden, but these fairly controversial regulatory measures in the form of RADV, prior authorization, and some rate tightening that could endanger MA along the way. That's not to say that President Trump did not have a little of that as well. And I want to make that clear. But in general, you would argue that Trump's policies tended to favor the expansion of Medicare Advantage more than Biden's do now, although generally both are reasonably supportive of Medicare Advantage. Within the Medicare fee-for-service environment, I would just have a couple of points here. I think Biden and Trump are very, very similar. Under Trump and into Biden, there was a lot of reform proposals within the Medicare fee-for-service program. And this actually started well before even both of them. But both of them have favored introducing new ways of reimbursing within the traditional fee-for-service program to bring about lower costs and better quality. I have great doubts about whether these will absolutely succeed, but nonetheless, both of them are somewhat similar on the Medicare fee-for-service policies. So that's a brief overview of the Medicare areas and how both of the leaders view the Medicare area. Let's move on to Medicaid now, because I think that in terms of Medicaid, there's really sort of a vast difference between President Trump and President Biden. So going back in time to the Trump administration, what is interesting is that Trump did agree to suspend Medicaid eligibility rules during the COVID pandemic. And that was interesting for a Republican president because that led to a huge increase in the rolls for Medicaid once the pandemic occurred. But I would also say that in general, President Trump was very anti-expansion in Medicaid. Once he got into office, he generally proposed to work with states to rein in benefits, to rein in eligibility, including recommending and agreeing in a number of waivers related to work requirements within Medicaid. And that is very, very controversial. But nonetheless, he did promote work requirements in a number of states signed up to have work requirements as a condition of Medicaid. So in general, the Trump administration tried to rein in the footprint of Medicaid and really pulled back in other ways administratively on expansion. In general, under the Affordable Care Act, Trump also did not generally support the expansion of Medicaid, although I will note that there were some states that expanded within his tenure. Let's move over to Biden. Well, when Biden came to office on the Medicaid issue, he really had a visceral reaction to the Trump, policies related to Medicaid. The first thing he attempted to do was claw back many of the waivers under Trump that limited expansion, including attaching work requirements. And so he clawed back those rules. Some plans gave in and did not move forward. One state, as an example, Georgia, challenged the Biden administration's ability to claw back a waiver that partially expanded Medicaid, but with a condition of work requirements on it. And in court, actually, the Biden administration lost on that clawback issue, and Georgia was allowed to move forward with it. So immediately coming into office, he tried to undo a lot of the limitations that Trump had put in place, including work requirements. In addition, Biden generally had a very pro-expansion agenda in Medicaid. He worked with states to expand various coverages for pregnant moms and children, and he vigorously supported expansion of Medicaid under the Affordable Care Act as well. And so, again, a big difference in Medicaid policy here for sure. Moving on to the exchanges, again, you can't find anything but big differences on this one. So when Trump was in office, he actually endorsed early on, when there was a Republican Congress, repeal of the Affordable Care Act. That did not happen because of some courageous Republicans in the Senate, including John McCain, who came back from brain cancer and cast a vote that ended up ensuring that the repeal of the Affordable Care Act would not occur. But Trump vigorously endorsed repeal. And as we know, even during this 2024 campaign season, he is also saying if he gets back into office, he would want to repeal the Affordable Care Act as well. And that would mean somewhere around 20 million people in the exchanges would no longer have coverage, and well more than 20 million people in the Medicaid expansion would not have coverage. So somewhere well over 40 million people now could have their Medicaid and exchange coverage or their health coverage in general theoretically go away if he were able to repeal. In addition to advocating for repeal of the Affordable Care Act, he also did a lot to injure the growth of the exchange coverage. What did he do here? Well, number one, he chopped back the open enrollment period. He cut back on outreach and marketing dollars, and in general had regulations that went against expansion. What did Biden do when he came into office? Well, similarly to Medicaid, he really undid everything Trump did, or tried to do most of it anyway. He basically restored outreach and marketing dollars. He made it much easier through enrollment periods and things like that for people to enroll in the exchanges. And enrollment continued to grow under President Biden's tenure because of the regulatory policies to generally expand rather than pull back. As we also know, he was a vociferous supporter of enhanced premium subsidies, and he was able to pass these enhanced premium subsidies, and they now go through the end of 2025. And beyond just the regulatory push for enrollment, these enhanced premium subsidies certainly also help drive enrollment. And today in 2024, we have now over 21 million people in the exchanges in 2024 from 2023. That was a growth of almost 5 million people alone in that year. So he's done a tremendous job driving exchange enrollment. And I frankly think he deserves congratulations for that as well. Number 4 area I want to talk about here is drug pricing. And in this area, it's pretty interesting because this is one area, and really a big area, where Donald Trump and Joe Biden do not look that different in my view. Although I will say that sometimes Trump's views on drug pricing can be a little bit schizophrenic. What do I mean by that? Well, in many ways, Donald Trump was an atypical Republican when it came to drug pricing. I think his populism saw that people in America are really hurting by very high drug prices. So he was not a traditionalist Republican and did not really support big brand pharma's policies, which generally you would think would have been the case. What Donald Trump did at one point was actually, because of rising costs in what are known as the Medicare Part B medical drugs, he had proposed putting in place price setting on these drugs through first negotiation, and then second, using international reference pricing to set the price of these very, very expensive medical drugs and Medicare. And one of the reasons he did that is because not only is it expensive to the federal government, but many of these drugs also carry 20% cost share by the member. So if drugs are in the tens of thousands of dollars, a 20% cost share can cost, thousands of dollars to people with cancer and other conditions, if not more than that. So Donald Trump proposed to move forward toward the twilight of his administration with the idea of negotiating Part B drug prices, as well as having international reference prices ultimately to set the price if negotiations did not work. He actually at one time even talked about extending this to Part D drugs as well, negotiations and international reference pricing. He never quite proposed that, but he talked a great deal about that. In addition, he did propose the elimination of rebates in Medicare and having rebates pass through as discounts at the point of sale to lower overall drug prices at the point of sale. This is really on brand drugs. And I talked a lot about, brand drug prices versus generic prices in an earlier podcast. He also endorsed drug importation and initiated the start of rulemaking to allow that. It was actually finalized under Biden. And Florida is very interested in doing that because they got the first waiver. But the first rule, in fact, came from the Trump administration. So let's talk about Joe Biden's drug policies here. And I did say that Trump and Biden looked a lot alike. So early on, President Biden did propose taking a really strong stand on drug pricing in America, also like Trump, recognizing the burden that brand drug pricing had on Americans. And so he finally won the passage of the Inflation Reduction Act Medicare drug price negotiation provisions. It allows about 60 drugs over time to have prices negotiated as a pilot. The first 10 drugs are now being negotiated between CMS and 10 brand drug makers, and prices for those drugs will be set and go into effect on 1/1/26. I referenced that Donald Trump had proposed Part B drug negotiations with international reference pricing. Biden's IRA Medicare drug price law doesn't exactly do that. It clearly has negotiations, but Biden does look at comparable prices in other developed countries as part of the process to determine what a fair price in America would be. So there you can see a lot of commonality between Trump and Biden. I would note, I did say earlier that Trump was a little bit schizophrenic on this drug price issue because as much as he proposed very strong negotiation drug pricing in the Part B world, at different points in time, he actually criticized the concept of broader Medicare drug price negotiations. As an example, when Democrats were advocating for drug pricing during his tenure, he actually came out and had his Council of Economic Advisors issue a report that did not reconcile well with the Congressional Budget Office and said that the impacts to innovation would be much greater than the CBO said. But again, that was a little bit of backroom maneuvering, whereas publicly, Trump and Biden on drug price negotiations actually look very close. What would happen in the Trump administration is anybody's guess, but based on his previous tenure, his policies look very much like President Biden's. I wanted to go to one other area here, the fifth area, which is price transparency. I'm a big believer in price transparency, and I'll probably have a future podcast on this. But in general, price transparency to me is very, very important. It's a very opaque system that we have right now. I'm not naive enough to think that having price transparency as we do today will immediately impact things. It clearly will not. But some of the price transparency rules that were passed by Trump himself do lay the foundation to bring better price transparency into our healthcare system. And what did Trump do? Well, under CMS, rules that he passed requires hospitals as well as health plans to disclose in readable files the prices that are paid to a hospital, as one example, or to other providers in the healthcare system across inpatient, outpatient, and other prices. So this was something Trump started. These files were posted. There are clearly some problems with them, and some additional rulemaking needs to occur to tighten this price transparency rule up. Biden has actually done that in some of his rules, and there probably would be more later. But in general, both Trump, who started price transparency in America, and Joe Biden, who clarified it and pushed it further, agreed that greater price transparency needs to occur in the healthcare system. In digital technology and things like that will make it one day, hopefully, easy to understand what a consumer would pay for a given procedure or going to the doctor and things like that. Much better than what we have today in the system. Number 6, the sixth topic I wanted to cover is what's known as the No Surprises Act. So under Trump, late in his tenure again, a bill was passed as part of an omnibus package that basically outlawed nationwide in the commercial world, because there were already protections in the Medicaid and Medicare world, but in the commercial world, what is known as surprise bills. These surprise bills generally would happen during emergency situations, as well as during complex surgeries. And both of these really related to the fact that you could see out-of-network providers in an emergency situation, as well as even when you're at an in-network facility for a procedure, there could be out-of-network providers servicing you that you're not even aware of. And so the No Surprises Act was a compromise bill passed in Congress under Trump's administration that basically outlawed these surprise bills going to consumers. And it basically set up an arbitration and negotiation process between providers and payers to determine what the insurer will pay the provider in these out-of-network surprise bill situations. Now, I do not believe this bill is perfect. I think on one hand, it does save many, many families from financial anxiety and even bankruptcy. But I will tell you that I believe Congress slanted this bill very much in favor of providers. And providers to this day are continuing to litigate it to make it even more favorable to providers. Donald Trump, again, under his administration, started this. I will also tell you that Joe Biden's administration has really sought to strengthen the rule and the law to make it much more even-handed and balanced so that we can actually bring down prices. Initially, the Biden administration had proposed a rule that would have forced the arbitrator to give deference to the average in-network rate in deciding these arbitration cases about what payment would be made to an out-of-network provider. That was struck down by court, saying it was not consistent with congressional intent. And along the way, the Biden administration continues to try and push small ways to get this arbitration process a little more balanced so that we do not see very, very pro-provider awards in the system and have costs continuing to be driven up. So again, both Trump and Biden supported the elimination of surprise bills, and that's another point of commonality. Let's go on to our seventh area here, and it's site-neutral payments. And there's a little bit of a difference here, although in some ways the administrations are a bit common. So let me work through this. So first of all, what are site-neutral policies? Well, it is the policy where the same type of service would be paid the same amount, whether it was at an outpatient hospital setting, an ambulatory surgery setting, at a physician office, for example, or even at home. If it's the same service, the same payment would be made to the provider across the board. Hospitals hate this because the current payment paradigm generally pays hospitals and hospital-related facilities more dollars. And hospitals argue that's because they have sicker patients and they have more infrastructure to support and things like that. But it seems very clear to me that if we are ever going to take a whack at our oversized pricing in America, that site neutrality is something that really should occur. Well, the Trump administration actually enacted a rule that would begin the process of site neutrality and also expanded the types of procedures that were eligible at ambulatory surgery centers versus just at inpatient. So the Trump administration supported both of those moves, and that, in concert with price transparency, would have made a great deal of difference, in my view, over time. They were baby steps, admittedly, but it would have helped a great deal to lay the foundation over time. Well, the Biden administration pulled back on both site neutrality and the expansion of ambulatory surgery eligible services. Although in general, the Biden administration is sympathetic to site neutrality. So Trump is probably a little more aggressive on this issue, Biden a little less so, a little more cautious. I would note that a bill passed in the House, and I'm still hopeful would be passed over time, would again initiate site neutrality in Medicare for at least Part B drug administration. So I'm still waiting to see if that bill will ultimately pass. But in the site neutrality area, Biden a little less adventurous than Trump, but nonetheless, he has signaled a willingness to think about site neutrality over time. And I'm going to end with number 8 here. Our 8th category is what I call antitrust and scrutiny of mergers and acquisitions. And so what do we mean here? Well, there has been a lot of consolidation activities over the last decade. In some cases, health plans got together and merged, or one health plan acquired another. It's also true that health plans have bought certain strategic assets like pharmacy benefit managers, provider groups, and other types of assets, including those that serve seniors for home care and long-term care and things like that. In addition, one huge trend over the past decade or so has been the acquisition of provider groups by hospitals. Today, over 50% of providers are now employed by hospitals or hospital systems. Also, private equity firms have gotten into the game of acquiring providers as well. And lastly, I would note that hospitals in the last decade or so have really merged rather incredibly. And so they've gotten to be very big and taken away competition in many cities and many regions of the country. I would also know that private equity firms are also investing in hospitals too. All of this has created a great deal of concern. On one hand, there's a lot of questions about private equity's role in healthcare and whether it's damaging quality. When hospitals merge, as another instance, there basically is evidence that prices are going up and quality is not being improved. And so this has led the Biden administration to make antitrust and scrutiny of mergers and acquisitions one of its major things. And in the past year or so, a number of executive orders and other regulations have been passed that will more closely scrutinize mergers and acquisitions throughout healthcare. They'll be looking at health plan acquisitions and mergers. They'll be looking at hospital acquisition and mergers, and they will be looking at private equity's role in healthcare as well. And so this antitrust merger and acquisition scrutiny is really something very big under Biden, and I frankly salute it because I think competition is being hurt, and we're actually seeing costs increase dramatically for any number of reasons. One great example I use is I've already told you that when hospitals merge, costs tend to go up and quality does not increase. But another part of what hospitals are doing, I told you that they're acquiring physicians. And what hospitals then are doing is changing physician behavior and directing their now employed physicians to move their site of service from perhaps a physician office to a much more expensive hospital-owned setting, like an outpatient setting. So you're getting a double whammy there. Costs are going up because hospitals are merging, but costs are also going up because physician practice patterns are changing when physicians become employed by hospitals. What did Donald Trump do on this end? Well, frankly, not a whole lot. There was some antitrust scrutiny under Trump, but this was clearly not a big issue. He tended to be a little more hands-off, and he tended to side with most businesses when they said they wanted to acquire various firms. Now, that's not universally true, but in general, the Biden administration has made this a huge cause because of costs being driven up. And Donald Trump was very much a little more hands-off. So that is my list of 8 areas I wanted to cover. There are many more out there, but I thought these were perhaps the most interesting. What have we learned here? Well, in terms of coverage, as I said, Joe Biden is very pro-coverage expansion, whether it's the exchanges or Medicaid. Donald Trump is somebody that actually wants to lessen, in general, the footprints of these two government coverage programs. When it comes to MA, Donald Trump may be a little more positive on Medicare Advantage, but we're seeing some bad calls and bad signals on the regulatory front coming out of the Biden administration, as well as, frankly, on Capitol Hill, and that's very worrisome. On price transparency, the No Surprises Act, and to some degree, site neutrality, the two leaders tend to be a little more in line. They are perhaps most in line, or at least from the records, they appear most in line on the issue of drug pricing, with both of them having proposed negotiation of drug prices and efforts to actually price set based on international standards and things like that. And lastly, on the antitrust front, as I just talked about, Joe Biden is much more focused on impacting mergers and acquisitions than Donald Trump was. So with that, that's my brief overview of how the leaders in the 2024 election, former President Trump and President Biden, line up. And I'm sure we'll be hearing a lot more on healthcare as the campaign goes on, and I will certainly be weighing in beyond this initial look at the candidates and their positions on these 8 issues. With that, I will conclude, and I will see you on the next Healthcare Labyrinth podcast.